Okay, this is administering thermotherapy. What I would do is check the paperwork orders from the doctor. Um, if, verifying the patient, what procedure is going to follow. And what I would do is go out to the waiting room, greet the patient, ask them to verify their information, their name, birth date, and so forth. And then once I know I have the right person, escort them back to an exam room. And what I'm going to do is talk with them, see how they're doing, ask them, how their pain level is. And what I would do is let them know that, what procedure we're going to be doing. In this case, Mr. Baggins. I would ask if they needed any assistance with getting ready for the procedure. If not, I would step out and give them time so they can undress and get into their gown or drape and so forth, come back in, double check the paperwork. I would wash my hands and don gloves and check the equipment that I would use, which would be, in this case, a heating compress on his lower back. Instruct the patient how to lay down, what is more comfortable in this case, like if he's laying on his tummy, have him lay down. Can't really see it, but he's laying down. And I would check my compress, make sure there is no defects to it, explain what procedure we're doing, and I would apply to the affected area. And say he has a specific time frame that he needs to have that compress on, I would come and check, make sure there's no irritation to the patient's skin, blistering redness, and so forth. Continue to check on the patient, see if there's any, if they're feeling any discomfort or anything like that. After the procedure, I would go ahead and remove said pack or heat compress or water bottle or so forth. Ask the patient if they need any assistance getting dressed, make sure they're feeling good before checking them out from the clinic. And then once patient leaves, I would go ahead and disinfect the area that was used in the exam room, and go ahead and take my gloves off, wash my hands, and document all the process that has transpired.